Cardiovascular changes. الهارت position at the diaphragm is elevated progressively during the pregnancy. The apex is displaced upward and to the left so that it lies in the fourth intercostal space outside the mid-clavicular line. The resting pulse rate increased from 10 to 15 beat per minute during pregnancy. Cardiac output increased mainly by increased stroke volume rather than increase in heart rate, reaching a maximum of 14% above the non-pregnant level at 20 weeks to be maintained till term. Arterial blood pressure usually decreases during the second trimester due to peripheral vasodilation caused by estrogen and prostaglandins. The posture of a pregnant woman affects arterial blood pressure. Typically, it's highest when she is sitting, lowest when lying in the lateral recumbent position, and intermediate when supine. الفينز بيبقى فيه varicosity أو varicose vein في اللور limb and the vulva due to back pressure from the compressed inferior vena cava by the pregnant uterus, relaxation of the smooth muscle in the wall of the vein by progesterone, وincrease the blood volume. علشان كده هو الwoman في الليت pregnancy lie in supine position. لو الأم نامت في supine position في الليت pregnancy أو في الثيرد trimester الهيفي يوترس فيل باك on inferior vena cava فبيؤدي إلى poor venous return, poor cardiac output وفي اللو blood pressure and fainting attack فبيدخلها في supine hypotension. Respiratory system change dyspnea may occur due to increased sensitivity of the respiratory center due to respiratory center to CO2, possibly due to high progesterone level, elevation of the diaphragm by the pregnant uterus. Gastrointestinal tract changes في gingivitis. There is increased vascularity and tendency for bleeding as well as hypersensitivity to the interdentally papilloma. وبيبقى فيه تايليزم والتايليزم يعني excessive salivation and more common in association with oral sepsis. Nausea and vomiting. nausea و vomiting بسميها more sickness with or without vomiting. لو vomiting بسميها emesis gravidarum occur في early months. appetite changes بيبقى فيه longing أو craving ودي معناها إن pregnant woman dislike from food and odors while desire others. Indigestion and fluidness decrease في gastric acidity caused by regurgitation of alkaline secretion from the intestine to the stomach وبيؤدي إلى decrease of gastric motility. heartburn due to reflux of the gastric content to the esophagus. بيبقى فيه constipation ودي بتبقى due to reduce the motility of a large intestine نتيجة progesterone effect, increase في water reabsorption from the large intestine aldosterone effect pressure on the pelvic colon by the pregnant uterus. بيبقى فيه hemorrhoids due to mechanical pressure of the pelvic vein laxity of the veins by progesterone constipation. Appendix is displaced upward by the enlarged uterus. Urinary system changes. Kidney renal blood flow and glomerular filtration rate increase by 50% by the end of the first trimester بيؤدي إلى decrease blood urea up to 10 mg per percent. Liability to nephritis بيبقى فيه stages of urine, increase in urinary amino acid and glucose content facilitate bacterial growth. اليوريتر بيبقى فيه dilatation في اليوريتر of the ureter and due to urinary relaxation of the ureters by the effect of progesterone pressure against the pelvic brim by the uterus particularly on the right side. البلادر بيبقى فيها frequency of micturition in early pregnancy and late pregnancy due to pressure on the bladder by the enlarged uterus congestion of the bladder mucosa. الاندوكراين سيستم ودي لها علاقه بالغدد. عند البيتيوتري جلاند الانتيريور بيتيوتري جلاند enlarge due to increase في البرولاكتين secretion. البرولاكتين level increase up to 150 mg per milliliter at term to ensure lactation. The posterior pituitary increase its oxytocin secretion near term to stimulate the onset of labor. الثيرويد gland there is diffuse slight enlargement of the gland. Gland activity increase as evidenced by the increase في البيزال metabolic rate by about 30%. الباراثيرويد gland increase في السايز and activity which act to increase of the calcium uptake in the gut and reabsorption by the kidney. weight gain average weight gain in pregnancy is احنا قلنا ان الام بتزيد من 10 to 12 كيلو at pregnancy. This increase occur mainly in the second and third trimester at rate of 350 to 400 جرام per week، يعني بتزيد من 350 ل 400 جرام في الأسبوع. 6 weeks of the average بيبقى 11 كيلو. weight gain in composed of الزيادة بتبقى في الماتيرنال tissue, breast, fat, blood and uterine tissue. and 5 كيلو another 5 كيلو الخمسة التانية of الفيتس placenta and the amniotic fluid. Thank you.